before
And they gave her
stretching.
the overflow. Stream is live.
Yeah.
Hi, hi,
I like that. You got that. You're like, yeah. All right. We are live. Hello, everyone. Welcome. Wow, September 30th. The year is going by quickly, but we're here still having conversations to help you live long and well. Today, we're going to be talking about medical care made simple, what busy moms need to know and deserve. And I'm excited to have on my guest, Dr. Sydney.
hi.
Doc, how you
Yes.
doing? Good to have you.
Always a pleasure, Dr. Tolu. Always a pleasure to hang with you.
And you are looking good, Doc.
Thank
And so
you.
I'm going to let you introduce yourself. Before we start, though, for those of you who are watching, who are busy mom, or you know a busy mom, can you drop a live in the comments? Let us know where you're watching from as well, so we can give you a shout out throughout the show. And I will say we will be taking questions, so please, please, by all means, drop the questions as you go. And this topic is very, very well needed.
Yes.
Um, and so we're going to dive right into it. Dr. Sydney, can you kindly introduce yourself? Who are you and what do you do? So we can go right ahead.
Absolutely. Hi, everyone. I am Dr. Cindy Ojewe. I am a family practice physician based in Pennsylvania. Um, I have a direct primary care clinic, meaning that we function as a membership based model to try to give our patients quicker access, more personalized attention, and we try to focus a lot on busy moms, which is the topic of discussion today.
All right, Doc, why do you do what you do? Is there any story that kind of highlight like what got you started in what you do?
Absolutely. I'm a busy mom myself. So I am mom to two babies, although they don't like me to say that because they are 10 and they are 7, and they want the world to know that they are no longer babies.
That's
Um,
fair.
and I'm a doc. I'm a very busy physician. I love what I do. I love taking care of patients, but I'm also a mom. I'm also a lady who likes to take care of herself as well. And sometimes it gets really, really hard balancing the different parts of you. So I totally get it. And I just want to make life a little easier for people who are trying to juggle multiple balls all at the same time.
Right. And thank you all for those. Oh, the Drakes are here. Good to see you. Giving you a shout out. And Jane, good to see you here as well. That's right, Joe. Good to see you. Thank you for joining. I'm going to dive right into the first question. So, moms are often the heartbeat of the home, but they're also
Absolutely.
the last usually to care for themselves. Example, you cut up the fruits for the kids and you eat at the leftover. You tell them what to do. You plan to have their checkups, but you kind of keep ignoring yours.
Mm.
Why do you think it's hard for moms to prioritize their own health? So you can help us. Let's start there. Why? Why do you think that is?
It's just the way we're wired. We're often, wired to take care of others, whether it's a spouse, whether it's the kids that we're that parent too. It's just the way we're wired. We put everyone before ourselves. That's what we tend to do. So it just comes naturally to us to make sure that everyone else is taken care of. And unfortunately, if we don't pay attention to that, that can have some lasting and serious effects as well.
So it's not a bad thing, right? We're nurturers. That's part of our wiring. I believe it's one of the gifts God has given us as women to be nurturers. So how do we learn to be nurturers of ourselves too?
Sure. And as a mom, I'm gonna be using a lot of mom examples, but I'm always preaching to my kids moderation, right? We Life is about balance. We always need that balance. So, as you said, we're nurturers. It's how we're wired, and that's not a bad thing. But it does become a bad thing when you go to the other extreme, right? And you tend to neglect yourself. So we have to make a conscious decision to put ourselves on the schedule, because we all have our schedules, multiple schedules. We get one master one, whether there's one that everyone else is connected to keep all the extracurricular activities on, and all the different vacations and work schedules. So we need to put ourselves on those schedules as well. Make sure that we're putting in self-care, we're putting in time for ourselves, putting in time for checkups our checkups. Yes, I said it. Moms need their checkups too. I did say it. Yes. But I'm
I'm not,
guilty. I'm
I'm
guilty.
not,
I'm
not
guilty.
feeling guilty. I'm not feeling guilty. No, I'm not. Nope. I'm gonna have this
We'll
conversation.
have that conversation later. But yeah,
Um,
I mean, we all do it. I do it myself. So but I made it one of my priorities this year to put myself make myself a priority, put myself on the schedule, and make sure that I'm taking care of me as well.
I like how you said the word "to" because sometimes when we hear, "Well, put yourself first," or "Put yourself on the schedule," and all the things, it sounds like, "Ah, yeah, you don't have my life. You don't say how busy I am." But there's a "to," so an inclusion factor
Exactly.
there. So put
Exactly.
yourself on there too. Now, what would you say is the biggest hurdles busy mom face when it comes to getting proper medical care?
Yeah. So again, it's time. Right? Time. I talked about the schedules. Um, there are just so many moving parts for
Right?
everyone else. So if you're a mom, you're working, whether you're doing a 9 to 5 or a week on, a week off, whatever it is for you. So you have your work schedule, then you have the kids schedule. They have school, and then they have their extracurricular activities. Then on the weekends, there's if you worship, there's time to go to church. And then there's that mom guilt, like, am I spending enough time with them? We have to kind of fit that in. We need family time. So trying to make have time to actually get things done, that's one of the biggest hurdles. So we often don't have the time. Um, Another hurdle that moms face in terms of getting into the doctor is that access, right? And sometimes it's not through any fault of theirs. It's just the way the system is set up. So again, they have this busy schedule. They have the times that, okay, I can probably fit this in, but does this fit with the doctor that I want to go see, right? So usually you can't get in when you want to get in, or what works for your schedule. So that access, maybe it won't happen for another month or another 2 or 3 months. Yeah, so it's trying to find that balance. And again, there are options as well, to get that. If you have to see a doctor on your own terms, get a concierge or a direct primary care doctor, someone who can fit in your schedule. But again, I keep preaching it. We do have to make time for ourselves, and whatever it takes. If you need to keep calling that doctor's office, get on their wait list. Tell them as soon as someone, you have an opening, you call me. Whether you have to go in on a Saturday, try to get it done. I'll keep preaching that.
All right. And there's a mindset, there's the guilt. So let's talk about the guilt because I think sometimes being the emotional beings that we are, which is a gift, our emotions are a gift, I believe. There's a tendency to feel guilt for stepping away to go to the doctor. One thing I've noticed, about women, just in conversation with, uh, other women, and it's like we feel bad for asking for what we need, but yet people around us do a good job of taking what they need from us because they know how to. And then there's this whole passive aggressive, like, oh, nobody does, but you're not asking for what you need. So,
Yeah,
so,
yeah,
so when it, let's talk about the mom guilt a little bit. How do we reframe that mindset where it's not like we're saying be selfish or you go do your manicure when your kids are crying? Like that's not like how do we reframe the mom guilt? Like, oh, I could be doing something else. I could be. How do you reframe that when it comes to going for checkups and going to get the care that we need?
So there's this analogy, and I'm sure you've heard it as well, Dr. Tolu, that you need to put your own oxygen mask on first, right? Before you can help someone else or your kids. If you're on the plane and the plane is going down, they tell you even before you help your child, you have to put your oxygen mask on first. And it's the same way in life, and with us, that whatever we're doing in life, we need to make sure that we're taken care of. You can't pour out of an empty cup. You have to make sure that your cup is filled. And for us moms, I think we have to reframe, that it's okay to take care of me. um, I am a person too. Remember that word too that we talked about. And I deserve the same love and care and attention that I am pouring out to everyone else, whether it's this my spouse, whether it's the children. So I am worthy of that as well. I deserve it, and I know. Don't get me wrong. I struggle with it. I think we all do, but I think we need to first realize that we can't pour out if we're not filled, and that it's okay to do that for ourselves.
Yeah, and I like what Dr. Mitra says here. She said, paying, and hi, Dr. Mitra, good to see you.
Hi, Dr. Mitra.
Paying attention to what our bodies are telling us.
Absolutely. Absolutely. And our bodies, they're always talking. They are always talking. I know, even some moms, I was just talking to a patient who was telling me, like, she got her period twice in a month. She was concerned, but then she acknowledged that, yeah, I'm pretty stressed. It's a really, stressful time for her. So we had this whole discussion. Of course, we're gonna work things up, but her realizing, like, it's a really stressful time, and that she's having some effects. It's having some effects on her body and how she's feeling, and so absolutely, we need to pay attention to what our bodies are saying.
And
Yeah.
that leads actually perfectly to my next question. What warning signs should moms never ignore, no matter how busy you are?
Absolutely. So we all know the big ones. Chest pain. Any chest pain that happens, any chest pain, we want to get that checked out. If you're noticing that when you're more active, oh, you're always getting that pressure like feeling in your chest, definitely. Um, I know, I've had a patient, and who has told me that she kind of delayed care because she was scared, but she kept feeling a lump every time she was in the shower. So certainly, if you're feeling anything, us ladies, in your breasts when you're showering, um, don't hope and pray that it goes away. That's why we're here to help get rid of problems, us docs. So if you have a family doctor, definitely book an appointment. And the list goes on. Lots of things that we take care of in the office, that we would tell you that when this happens, if you're past the period age and all of a sudden you're starting to bleed, certainly get that checked out. We would definitely want to see you. So there are lots, but those are a few.
All right. Thank you so much. And of course, we encourage conversations with your primary care doctor, your healthcare giver to, and I also recommend, of course, your wellness visits. And that's my next question too. You don't wait till you break down before you go for a checkup, because
Exactly.
a lot of systems are tied to you, mom. A lot of systems are tied to you. You're the glue, you and guy, you glue. Yeah. So it's really important that you're taken care of so those systems don't fall apart. So how can moms streamline their health routine? So their checkups, their screening, self-care, so they don't feel overwhelmed. First go check one limb, check your breast, check this, check. So how can we streamline it to make it a little less overwhelming?
Sure. So you try to, um, I know, So I am trying to get very efficient with my time. One of the things I do, I tend to make a list of the errands that I need to run, and I try to do them in groups. And I'm trying to apply that in my life. Like I have a podcast. I'll do batch podcast recording. So I tend to group things. So if you're booking appointments, you're making the appointment for everyone else, whether it's that sports physical or that back to school, physical, put one on the books for yourself while you're doing that. Group your appointments. Certainly, that's one way to streamline things. um, Another way would be, say for example, um, you you know that it's your birthday, right? You're thinking about things that you could do for yourself. You can use that as a certain time, or a certain season, to get things done for you, including your health checkup. You know that the family's probably asking you, "Mom, what do you want?" "Oh, I just need some time to myself." Make that a full healthcare day or season or week, whatever it is for you, just for you, and make sure you include your annual checkup. And at that annual checkup, try to get talk to your doctor, get everything done. I know us docs, we don't like to do everything. So if you're coming to, "Oh doc, I had my knee pain a year ago, but I also need to get my pap smear done," probably your doctor will say, "Maybe we might need a few visits. Let's not try to cram it all in one." But if you're try to get all your labs done, get your annual screenings, depending on your age. Try to group things. That tends to help streamline things and get you where you need to be quicker.
I like that. And I like the birthday, your birthday is a good time. The whole month is celebration of you. So your wellness is part of that whole
Yes.
month, the month of you. Okay. So
Celebrate
you can,
you
yeah,
first. We have to start doing it. It's a whole
celebrate.
mindset shift.
Yeah, the whole month. And so that month, every year you remember, okay, this is time where I go for my checkups to make sure, you get that taken care of. Now, what's the emotional toll of neglecting personal health and how does it ripple? And I'm saying this not to scare moms, but just say, you know what, it's really important to have that. Oh, yes, Dr. Valerie, include dental. Take care of your teeth.
Yes.
Well said. My dentist, she said, don't forget your teeth. And yes, I agree, Dr. Mitra. She says, I'm fine. I don't need to see my PCP is not a helpful thought.
It's not.
But what's the emotional toll of neglecting personal health? Like, how does it ripple into family health? In your experience, having conversations with some of
Oh
your
yeah.
clients.
So moms tend to be the ones that, even in my own family, we do it so well. We do what we do so well that sometimes you feel like you're taken for granted, like what you mentioned about how sometimes you're passive aggressive, like I do this, I do that, like what am I getting to? But we tend to be um that rock that often gets overlooked. So, for example, if all of a sudden mom has a cold and she's laying in bed, and she can't get up, it's like the whole world has turned upside down. Like, oh my gosh, where's the food? Where's this? Where's that? It's it's almost like the schedule, or has it's not the same. So when you don't take care of your health, that can ripple on an even bigger scale. um, I've seen families, and it's not through anyone's fault or anything, but I'm just saying, like when mom is sick, it can affect the whole family. Kids have to deal with mom having a terminal illness, and that can affect them long term, their mental health. it can affect the way they interact with other people. And I'm talking from experience with that. Um, but there are different ways, of course, that that can affect families. So one of the ways that we can show our families that we love them is by taking care of ourselves, making sure that we keep up with our annual visits, make sure we're doing all our screenings. When something is concerning, following up with that, not you know trying to sweep it under the rug or say I'm going to pray about it and not do anything about it. And I'm a Christian, so I am talking to my Christian folks as well. I think medicine also works with faith, and a lot of times we tend to choose the faith and not the medicine. But medicine, we're here to help. We are here to help. So definitely get in with your doctors, get in and get those checkups done.
Yes, faith and works. And um I like how you say one of the ways we can show we love our family is by taking care of ourselves. If some of my family members are watching this, they will be like, yeah, they'll hold on to that phrase. Like, yeah, I'm gonna quote you. You should go watch this. Okay, so this is good. And I have to share. It was during COVID that this really resonated more for me. So I am doing a better job. We're still on the journey as well, as far as taking care of ourselves as moms, so we can take care of everyone else. Um, and it was a Bible verse: "Love others as you love yourself." There was a big self care movement. It was a big thing, and it didn't quite resonate with me because I'm like, you love others first. Like that's just the
Right.
mother thing to do, to put others. But the inclusiveness of love others as you love yourself, let as you love yourself kind of was highlighted, and that is scriptural. To take care of
Yeah.
yourself too. And so
Yeah.
that's what this conversation is about. Is called balance.
Yes.
So I'm gonna put that in the comments here for us to go and screenshot. And one of the ways we can show we love our family is by taking care of ourselves. So that's beautiful.
Yeah.
Now, some people may be watching here who are actually not moms, but they're like, you know what? I'm concerned about my wife. I'm concerned about my mom. I'm concerned about women in my life that I love, and I want to kind of share this. So they're watching to see if this is something they're going to gift someone to watch to empower to make better health choices. So how can partners, family members, or even kids help make medical care less stressful for moms, for that person watching who wants to show mom some love?
Yeah. Um, so I have kids, um, and sometimes they are my biggest cheerleaders. Um, they laugh at me, like this whole 6 7 thing going on, or me saying bruh, like it sets them off. um, so sometimes I recruit them to help me when I need to get something done. And they keep to task. They will, if you give them a job to keep you on task, they will be happily keep you on task. So and they're you can make it fun, involve your family, help them, explain to them. I always tell my patients communication is key. A lot of times if we explain, our thought process or why we're doing what we're doing, it tends to get everyone on board. It tends to get that whole team mindset. We're all helping moms stay healthy. I have a Peloton downstairs that I don't tend to use as much as I should. But my kids help me keep, they keep me on task. So little things like that can certainly help. um, they can help by not making mom feel guilty if she's taking some time off to go for a doctor's appointment. If you need to help out and babysit as a spouse, that's helpful. That shows that you care. So those are ways that we can help as family members.
Awesome. And for that person who's watching, who's like, you know, ah, they feel like they're dismissed, doing, an appointment. So, there's a mom who's watching who's like, okay, I need to go for my checkup, but I don't know how do you advise them to advocate for themselves, and to ask for what they need? Because sometimes I'm like, oh, I'm just here. Oh, any concerns? Before I go in, the medical assistant, none. And then I go in, how you feel? Oh, I'm tired and this. How do you encourage moms to advocate for themselves so they can make the most of their doctor's visits?
Yeah. So it's funny that you said that. This morning, actually, I was talking to a family friend, and she she's a powerhouse, but she was sharing that when she goes to the doctor, um, she has this whole white coat hypertension happening, and it's not that it's not that she's intimidated or as she described it, it just happens, and she recognized that maybe I should find another physician or provider that would she could be more comfortable with.
Mm.
So that's one of the first things I would say is kind of try to figure out who you're going to see. Are you comfortable with them? And comfort levels vary, and they are different for whatever reason. So try to find someone that you're comfortable with, first of all. um, Second, if you're feeling like um, maybe if I go into the office, I'm gonna be dismissed, or I'm not gonna be taken seriously. Maybe try to see if you can do it a different way, right? And by that I mean there are different models of care now. So we have again, I'm gonna say it, Dr. Tolu, we have direct primary care where
Oh, yeah. Talking.
and there are other sometimes providers can come to your house if that's more comfortable for you, but there are different models of care, so you can explore that to see if that would work better. But no one should feel dismissed in their visit. No one. That's not normal. That should not be tolerated, and it happens for whatever reason. But I would certainly encourage you to find someone else, and find someone that you're more comfortable with. But yeah, um, I don't think that's nice. No.
Yeah, the truth is, you want to find a good fit for you, where you feel listened, where you feel heard, and a clinical team member that is a physician who caters to your needs the way you feel heard. And so, we should mention direct primary care, a concierge service model where you allow longer times to talk with the doctor, and that works better for you, or having a doctor actually come to the house.
Yeah.
So it's really important you find a good fit, but asking for what you need is important. I recommend having notebooks. What's important to you? What are quality measures, quality of life measures that matter to you, not what you think you want the doctor wants to hear. But ask for what you need. You don't receive because you don't ask.
Hey,
Um, so for that mom who's watching, because we're about to wrap up, we got 2 minutes.
sure.
What, what's the one self-care or healthy routine that you wish every mom treated? You know how brushing the teeth is non-negotiable. I can almost
Yeah.
guarantee like every mom does that. Like, what is one self-care routine you wish every mom would do?
Me time. Every mom needs their me time. I hinted at that before. You need your me time, whether that's 5 minutes in the day, or it could be half a day, a whole day. You need your me time. Again, you can't pour from an empty cup. You have to put your own mask on first, before you help someone else. So that me time, whether it's your prayer time, whether it's your meditation time, whether it's your reading time, whether it's I just want to be by myself, no one around me time, whatever it is for you, we absolutely need that time, and we need that time and to not have that mom guilt while you're taking that time. But I totally get it. Mm-hmm.
I like it. And me time that resonates with you, like your own me time.
Exactly. Exactly.
I used, I used to, I used to be like, oh, people doing their nails. I'm like, but I hate getting my nails done. They pick up my cuticles. It
Yes.
hurts. Do not like. I don't come up feeling like, yeah, I did my like. I don't feel no. So
No, that's
what
not your
resonates
thing.
with you?
No.
Nah.
Well, what's
So
your thing, Dr. Tolu? What's your me time
my
thing?
morning routine in prayer and with the word where I twirl and I worship off key, on key, don't matter. And I can do in the presence of God. Ooh, that's me
God
right.
doesn't care. He doesn't
I
care.
I sound heavenly to him. My keys are always on point. So that's one. And then I love reading. So it's just reading a
Okay.
good book by
Right.
myself, listening to worship. Like that's
Right.
and then I'm dancing and being as goofy as I need to be. No judgment. I love it. Love it.
Nice.
But this was good, Doc. We're gonna have you again. So I like to ask live that way you can't say no.
Can't say no.
It's kind of awkward if you say no live. It's kind of like, wow, Doc, wow. I couldn't even say it offline and stuff. So we have no record that we're gonna do this again. Most likely in the new year. Just to encourage moms, I think, for balance because moms are such glues, and so when they're taken care of, I believe the
Absolutely.
the centering or the other orbital components of their lives are more
Agreed.
balanced. So,
Agreed.
Doc, for those who are watching, who are like, man, I like this doctor. She's in Pennsylvania. I'm in that area. Doc, where can people find you?
Absolutely. So you can find me on www.drcindycare without an s.com. Um, and we're also on Instagram at Cindy Ojewe MD. We're also on Facebook, Dr. Cindy Care LLC. I also have a podcast, The Care Room with Dr. Cindy. It's available on YouTube, Apple Podcasts, and Spotify. I'm trying to let Dr. Tolu keep up. That's why I'm.
Say Dr. Slow? No, play Dr. Slow? Wow. Wow. Okay. Oh, that's funny.
I love you, Dr. Tolu.
Man, like, let me wait for you to type. Go ahead. Oh, and then I forgot, I didn't get the Facebook one. Tell me the
That's
Facebook.
okay.
So Facebook is Facebook the same thing at Cindy.
At Cindy Ojewe MD.
Okay.
Yeah. I apologize. It's Dr. Cindy Care LLC. Facebook. Yeah.
Cindy Care LLC.
Yep.
All right, there you have it. I have all the things on the show notes, in the text, in the comment section, so you could follow her. A lot of comments, good. What's the word? A lot of good content. A lot of good content. Watching her podcast and watching her live. What I encourage people to do is take one or two things wrong with it. Don't feel overwhelmed. Pick one or two things you're going to start to do, implement, and go get it. So we're giving you virtual high fives. Thank you for joining.
Yes.
Your presence here speak volumes. But Dr. Sydney, I really want to appreciate Ojewe. I want to appreciate you for taking the time to come out of your busy schedule to spend time with us. So if you don't mind, you could drop a comment. Appreciate her for me. Help me celebrate this gift of a woman for stopping by. And yes, Jan. There's so many millions of roles for moms: teacher, nurse, soccer mom, coach, homework helper, lawn care, grocery shopper, scout leader, homemaker, making the meals. Wow, packing lunches, cleaning the house, taking care of children, taking the family to church, and even taking care of the husband. There wasn't enough time for their own care. Good tips to make yourself a priority too.
Yeah.
All right. Amen. Amen. Well, thank you. I appreciate you big time.
You are very welcome. As I told you, anything for you, anytime. Take care.
I appreciate. Thank you all for watching. Shout out to those watching live. The comment. I see the hearts. I see the thumbs up. Appreciate you. Please share this to your mom. Share this with your mom. Share this with moms, women who could use some encouragement. And as always, please subscribe so that way it can move in the space of the tube and stuff, like whatever it's called. Subscribe so we know that what we're doing is actually making a difference in your life. And as always, if you or anyone you know is looking for a thorough, a compassionate and caring family physician, that we have conversations like this to help you live long and well. You know it. I am she. Have a good one, everyone. This was good. This was good.